Full arch implants, pre- and post-operative instructions.
Preoperative instructions. You should have nothing to eat or drink, including water, for 8 hours before surgery unless otherwise instructed by your physician. You may have a very small sip of water with Pepcid, AC, 20 mg, and the preoperative Synec tablet, as well as any medications you have been instructed to take. The Pepcid AC and Synec were provided at your preoperative appointment. The morning of your surgery, wash your face with Hibiclens, provided at your preoperative visit, by gently rubbing for 5 minutes with a washcloth. Rinse well with warm water. Do not use your regular soap or any other cosmetics after using and rinsing with Hibiclens. Pat dry. Absolutely do not take aspirin-containing products, or ibuprofen products for at least 10 days before surgery. Please refer to the provided list of medications to be discontinued before your procedure. Please abstain from using any tobacco products for at least 1 month prior to surgery. Failure to do so will result in cancellation of your procedure. Please do not wear makeup, lotion, jewelry, nail polish, or contact lenses the day of your procedure. A responsible adult should accompany you the day of your procedure and be available to pick you up afterwards. Post-operative instructions. Resting sleeping position. Because blood pressure, and thereby pain, increases when the head is placed below the heart, it is recommended that all patients who have had head and neck surgical procedures keep their head elevated above their heart by sleeping on 3 pillows for the first week after surgical procedures. Ice and heat. Ice packs can be used for up to 72 hours. After 72 hours, switch to warm heat, which will hasten resolution of bruising. Swelling. It is obviously normal for all patients to have some degree of swelling after facial surgical procedures. In general terms, the swelling increases up to 48 hours and then will slowly start to decrease. By 2 weeks, it will be 80% gone and will usually be completely gone by 3 weeks. Wound care. External skin incisions that have been closed should have suture line care 3 to 4 times per day, with a 50-50 mix of hydrogen peroxide and water. Dip cotton tip applicators in this solution to cleanse the area. Do not allow scab formation or tissue exudate to form on the wound. After cleansing, cover the incisions with a thin layer of antibiotic ointment. Proper wound care will minimize scarring. It is acceptable to get skin incisions wet in the shower, not soaking in the tub, but the incisions should be carefully dried and antibiotic ointment applied immediately. Showering. You may take a shower 2 days after your procedure. Avoid letting the water hit directly on your incisions. Apply antibiotic ointment when done. Medications. Depending on the surgical procedure, patients may have numerous medications at the time of discharge. They may be in liquid or tablet form and should be taken exactly as prescribed. Only take pain medication when needed. Antibiotics, decongestants, and anti-inflammatories should all be taken as prescribed for the full length of the prescription. Activity. The level of activity recommended to patients upon discharge varies depending on the operation and how the patient is feeling. In general, the patient should attempt to do some activities around the home. If fatigue becomes a factor, you should take a nap or rest. After that, get up and attempt to continue with your normal activity. The sooner you are able to achieve your normal level of activity, the sooner your recovery will proceed. Do not do anything to elevate your blood pressure for the first 2 weeks after surgery. Do not lift more than 10 pounds. Avoid trauma to the surgical area. Follow-up appointment. All patients will be given a follow-up office appointment for suture removal and/or to check incisions. It is extremely important that these follow-up appointments be kept for proper evaluation of your surgical procedure. Our office number is 208-344-9115. If you are unable to reach your physician, call our answering service at 208-327-8171 to reach the doctor on call.